We have live team coverage for you this afternoon. We start with News 4's Andrew Siff live on the west side. Andrew.
And Natalie, in a moment, we're going to try to put some of that antibody testing in context for you. You'll hear the governor describing it as a key to beginning to reopen portions of the economy. But behind me, you can see that hulking ship, the USNS Comfort. We've learned that it could be pretty soon that it will be finally setting sail. 3 weeks after it arrived, the USNS Comfort is almost ready to leave.
We've cared for over 180 patients so far. We still have patients on the ventilator in the ICUs.
Captain Patrick Amersbach is the naval commander aboard the Comfort, well aware the reality changed. New York did not end up needing its 1,000 beds and 12 operating rooms.
The numbers, okay, somebody has paid attention to that. We only care about the patient in front of us. We have made a difference.
Also making a difference, says the governor, new antibody testing. Today, new results reveal 2.7 million people in the state have likely had coronavirus.
When you start reopening, you can watch that infection rate to see if it's going up, and if it's going up, slow down on the reopening strategy.
His team has already eased the rules on construction, like at this Upper West Side high-rise, now allowed because it includes affordable housing, or this West Side project for a hotel also considered essential.
There may be some cases where people see something, they think it's non-essential, but it actually does fit the standards for what essential is.
But I asked the mayor if New Yorkers are getting the wrong message, that it's okay to not stay at home.
Are you concerned that there's been an uptick in traffic?
On the uptick in traffic, yeah, I do share this concern. Now, I've been seeing it personally, and I am worried about it. If it's folks starting to get a little too loose, that's a problem.
Meanwhile, those on the front lines continue their fight. At Metropolitan Hospital in East Harlem, doctors and nurses who arrived in from other states trying to be part of the solution.
And this being the epicenter of the disease, I had to come. I had to be here for these nurses, for these physicians, for these patients.
As for the Comfort, the commanding officer told me there are still 50 patients on board, some of them still critical. There's the delicate task of moving them to other facilities before this ship can leave the waters of New York. Live on the west side, Andrew Siff, News 4 New York.